Okay, so we are going to get started this afternoon. Thank you everyone for joining us and for taking the time out of your day to be here with us today. We hope you're all well, and we're going to get started with the webinar today. So the topic for today's webinar is on the travel resumption process, and we have two staff members from IRCC. We have Julie Clark and we have Frangelico Gregorio Thomas, who will be sharing information with you all about the travel resumption process. After they have both presented, we will be opening up the floor to Q&A, and I'm sure you're all familiar with this now, but just in case you are new to the GoToWebinar platform, this is how you can send your questions in over the course of the webinar. You should see this control panel somewhere on your screen, and you can type your questions into the question box, and they will pop up on our screen as they come in, and we will be going through those questions in the order that they came in the Q&A part of the webinar. So if you have any questions over the course of the session, any questions related to the content or the travel resumption process, please do enter them into the question box, and they will be answered by Julie and Frangelico. If there's also any audio issues or any technical issues, you're having difficulties seeing the screen, please also enter those issues you're experiencing into the question box, and we will try and fix those issues and address those issues if and when they do come up. Just a quick housekeeping issue when it comes to Q&A, we kindly request that you keep your questions related on topic and related to the subject of the webinar. So the focus of the webinar today is the travel resumption process, and we will be looking at the process and the procedure itself. We won't be looking at some of the wider policy issues or questions related to the resumption of resettlement. We're looking at the actual process and procedure by which travel to Canada will resume for privately sponsored refugees. So having said that, I'm going to pass it off to Julie and Frangelico, and they will lead us through the rest of the session, and then we'll come to the Q&A. So Julie, I'm just making you a presenter now, and you're able to share your screen.
Thank you very much, Sunit. I just want to make sure that you are looking at the right screen. So if you could just let me know if we're looking at the IRCC logo screen that says resuming travel for privately sponsored refugees.
Yes, we are.
Perfect, because I have two screens. I wanted to make sure I'm sharing the right one here. So first of all, I also would like to thank everyone for the attendance. I understand this was a sold out show very, very quickly, and I think that reflects the angst and concern that you have for the refugees that have that you have sponsored, and to get information on when we will be resuming travel so that these individuals can come to Canada. And I want to thank you up front for your patience. I know it's been a long process. I understand the frustrations and concerns of many of you with regards to the status of refugees and having to wait that much longer, and also just overall concern for refugees who are further disenfranchised by the COVID situation in their host country. So it's made a horrible situation even worse for refugees, and we all shared your concerns with regards to their health and safety. So I'll start with that general comment. As Sunit mentioned, I really want to focus, because I think you guys all want the answers to this. So all of the questions, if we can focus on just the, how are we going to move refugees, and what do you need to do, and what are we going to do, and what is everybody's roles? I know there are lots of broader policy questions or concerns around, what is the levels plan? How many admissions are we going to have this year? What is the levels plan going to look like next year? Those questions, there will be a forum for that. There is going to be some policy discussion. There's always a consultation process with regards to the levels plan every year, but that's not this session. So what I would suggest is, if you have a lot of those questions, feel free to chat or to type them in, but I'm not going to answer them here. And we will have a discussion with SOC Council about what's an appropriate forum for those questions going forward. But rest assured, we understand why you have those questions, but just not this particular session. And given that all of the attendees are going to be focused on resuming travel. We want to make sure this is a focus session on that. So thank you very much also for clarifying that, Sunit. So just to give you a heads up, good news, we have resumed travel movements. We are starting slow. We have resumed travel out of 4 countries right now: Thailand, Malaysia, Indonesia, and the United Arab Emirates. And why did we pick those 4 countries? Those are good questions. And if you look at the screen that's up there, the process for identifying cases is something that we've been working on with our partners on the ground and with our missions, with IOM and UNHCR, and this is how we're going to proceed. So we will move or initiate resettlement movements when the following conditions are in place. The first is that there are suitable flight routings available. So some of you have sent emails to us saying, hey, I can book a flight on Expedia. Please book my refugee, I'll send you the information. So yes, there's lots of flight announcements out there, but actually those flights aren't necessarily flights. Airlines do, in some cases, continue to post or advertise flights, but then the flights never materialize. So IOM, who manages, I would say, 90% of the travel for refugees for Canada, has relationships with the airlines and knows when the flights are solid, when those flights are guaranteed to go, because the worst thing we want to do is start moving a refugee around or starting the process. For example, putting a refugee in Istanbul and getting them there, all of their belongings have been sold, whatever housing they had arranged is no longer there for them, and they're sitting in Istanbul waiting to board a flight, and the flight doesn't take place because it was a tentative flight and it was canceled. So we will not, we do not want to risk that, because that just creates further angst and risk to the refugee. We already went through that in March when we had to cancel some flights. We don't want to go through that again. So we're making sure that we have suitable, appropriate, and confirmed flights for refugees. The second point is that not all routings are appropriate for refugees. They're traveling on documents issued by the Government of Canada. They don't have passports. They do not need to seek transit permission. That is handled by the International Organization for Migration. So if you and I are booking a flight that has to transit through other countries, we need to make sure that we've met all of the visa requirements or travel authorizations required to transit through any countries. We take care of that for you. The sponsors and the refugees don't need to worry about that, but not all flight routings are suitable for all refugees. Really good example of that is that under no circumstances do we have refugees flying through the US. They always fly through Europe or direct into Canada. There's also the potential for no board, even if the flight routing doesn't go through the US. If it touches a certain perimeter of US airspace, what happens is the airline is not allowed to board the refugee or the family because the name hits on someone that's on the no-fly list into the US. That happens quite frequently, so we need to make sure that they're on a suitable flight routing to try and minimize that risk, and to make sure that IOM is able to, on the ground, support anybody who gets stuck in that process while they're in transit, because then IOM and the Government of Canada assist the refugee in transit if they end up in that situation, and we rearrange their flight routing for them. So the suitability of the flight routing is really important. Secondly, we want to make sure that pre-departure support is available, which is usually provided by the IOM. In Israel, for example, that's provided by the Government of Israel. This means that there's assistance to help get exit permits if the refugee, in some countries, IOM supports the application process or supports the refugee. In some countries, the refugee has to apply themselves. We want to make sure that somebody has to actually give the refugee their documentation. So they need their single journey travel document, their visas, their COPR, and other information to support the travel experience. We want them to have some pre-departure counseling, which I'll talk about a little bit about later. So that support needs to be ready to go on the ground. And if we don't have freedom of mobility or IOM can't support the movement itself, then we're not ready to move the refugee. Usually that goes hand in hand with expanded international travel. So if the country is starting to open up, movement is resuming, then IOM is able to offer that support as well. Thirdly, we want to make sure that the family itself, so in some cases we've heard of people saying, well, there's flights available. Yes, but the refugees are not allowed to leave where they are right now. So there's no freedom of movement. So that's important as well. We need to be able to get the family from wherever they are residing now to that point of international departure in that airport. So if they don't have freedom of movement, if there's curfews or restrictions on movement, it doesn't matter whether there's flights available. Lastly, in most cases, the host country issues an exit permit, and that documentation is required before the refugee can leave the country. So if the host government is not supporting the exit permit process or not at full strength, the exit permit process can be delayed. That will impede travel as well. So we're working with the missions on the ground and with IOM to make sure that we can get exit permits in a timely way. If there are delays in obtaining exit permits, it doesn't mean we won't move people, but it may take us longer to do it. A note about this. Many sponsors are contacting IOM directly and saying, please book my travel and give me my visa, I'll do it myself. IOM's just going to send you back to us. Those travel documents are the property of the Government of Canada, and IOM is only allowed to release them when the Government of Canada says they are authorized to do so. They are not allowed to just hand them over to the clients. So if you attempt to contact IOM, IOM is going to tell you to contact IRCC. That is the discussion around identifying cases. Now, within that, there's a couple of other clarifications. We are trying to triage the cases. So if there are things like if the documents are going to expire soon, we will try and get those cases to move more quickly so that the documents don't need to be reissued. In some cases, the date of the validity of the document is tied to one of the clearances or approval processes that goes along with the application process. And so if the refugee doesn't travel before the validity date of their visa and confirmation of permanent residence, we actually have to redo some processing steps. And we really don't want to do that. I know that just causes more, frankly, annoyance for everybody. The last thing that we want to do is to have to make refugees redo processing steps. So that's one of the priorities that we're looking for. In some cases, there's an identified vulnerability with the clients. Now, these are refugees. Everybody's vulnerable. So we're going to try and move everyone as quickly as possible, responsibly, but as quickly as possible. But if there is a particularly vulnerable case for whatever reason, sometimes we're moving them to the top of the pile. Our focus right now is on moving the cases where the documents were issued prior to March 18th, or the application was approved prior to March 18th, or travel had been booked and was canceled. We're not worrying about moving new cases right now. These are the cases that were already done and at the end stages. The reason for that is because there are travel restrictions on who can arrive in Canada right now. And one of the groups that is exempt from those travel restrictions is anyone whose application had been approved prior to March 18th. So those are the cases we can move easily right now. They are allowed to enter Canada. We can also move cases where their immediate family is a permanent resident or citizen of Canada and residing in Canada. So one-year window cases, for example. You may be aware that some privately sponsored refugee cases have been moving all along. We do have a very, very small group of individuals who still arrange their own travel. It's rare now, but there are some cases, and so those individuals had booked their own flights and have arrived. And we've actually been contacting them to say, how did your experience go? How was your port of entry experience? Did you have any challenges? And we've been getting feedback for people who've gone through the process already. Lastly, one of the things we're just keeping an eye on with our partner, the IOM, is flight costs, because, for example, people have been trying to see if they can get refugees on repatriation flights or other chartered flights that are taking place, but the costs were astronomical. So from our perspective, it's not reasonable to ask a refugee to pay $10,000 per person for their ticket, for example. That's just not a cost that is fair. And certainly the department isn't able to cover those costs as well. So those are just a little bit of a caveat there. We are keeping an eye on the costs of the flights. If you have any concerns about that, you can let us know. So That's the process for identifying the cases and which refugees are going to move out of what country. And I don't see any questions popping up, so I'm just going to keep going. But if you have a question about that process, I'm happy to talk about it within here. I think we've got lots of time, so I don't mind breaking up the sound of my voice with a question, and then Frangelico or I can answer them. But given there aren't any, I am going to move on. The second component of the trifecta of our resumption process is ensuring that you are prepared to receive your refugee. So we're not going to put refugees on a plane and then say they're coming tomorrow, show up at the airport, pick them up, and it's your job to look after them. We're going to manage this process with you very responsibly, very carefully, cautiously, I would say. We don't want to end up in a situation where we move a refugee that you are not ready to provide settlement support for. That's just not going to be helpful to anybody. And likewise, you can't force us to move anybody till we're sure it's the responsible thing to do. So this is going to be a partnership. There's a couple of things we need you to do. So we need you to know whether or not your refugee is able and willing to travel. So there is a lot of upheaval on the ground in a lot of countries. And when we contact you, we're going to ask you, we're going to give you a couple of days, but one of the things we're going to do is ask you to confirm that the family that you're sponsoring is still able and willing to travel. It shouldn't be that complex, but you never know. The second component is, have you arranged for suitable transportation from the final destination in Canada to the accommodations where they're going to have their quarantine? So I'm sure it's not a surprise to anybody, but the government has put in place mandatory requirements for quarantine for any international travelers arriving in Canada. And all of this information is on the Government of Canada's website. What I'm going to do is just quickly flip to that and show it to you, because I know there's a lot of questions about that and people are concerned. It is not scary. So here's the website, and there's a link to this on the IRCC website to it. It's also going to be in a copy of the letter that we give you, and I'll flash that letter up quickly. So we're going to give you a letter saying your refugee is going to be ready to travel, and there's links, so you can go to the website where it explains the quarantine. So let me just go back to that website. Everything you need to know is here with regards to a quarantine plan. We are not going to provide you with quarantine plans. We're not providing you with guidelines on how to write a quarantine plan. It's really not about the written document. It's about having a credible plan. And what I mean by credible, I'll explain that. I'll show you what is currently the requirements. They're not that complex. This is very, very straightforward. The requirements are simple. The website information that the government has provided is clear, and there's nothing IRCC could give you that is better than what is already up there. Okay, so we really want you to go to the Government of Canada's website and look at the requirements that are up to date and relevant for your situation. The other thing you're probably going to need to do is check provincial and municipal requirements as well, and make sure that your plan complies with any local or provincial requirements. So there's the federal guidelines, but there may be requirements in your province. Ottawa very recently imposed wearing of a mask is mandatory inside any building in Ottawa now. That was not the case beforehand. So it's a new requirement. Those requirements are being imposed very quickly, and any guidelines IRCC provided, we wouldn't be able to keep up with that. So we need you to do your homework and make sure that you've checked and that your quarantine plan meets all of the required guidelines. So if you go through this website, there are some links, and you can link to the information that provides more details. And you'll see there is guidelines for the mandatory quarantine. And if they arrive and have symptoms, there's mandatory isolation. I'll talk a little bit later about isolation. Let's start quickly with the quarantine. Okay, so here's a one-pager from Public Health Agency of Canada on the mandatory quarantine, and you can see there are nice little green check marks about what they need to do, and red ones about what they're not allowed to do. Your credible quarantine plan has to cover these check marks. That's it. It's that simple. So do they have somewhere to go, a place where they can have their 14-day quarantine plan? And do they have access to the necessities of life? So somebody needs to make sure they have groceries and food, et cetera, et cetera. They have to go there directly. Now, some families will be arriving internationally to a port of entry like Toronto, Montreal, Calgary, Vancouver, Halifax, and then they have to take another domestic flight. In a very small number of cases, they overnight, usually in Toronto, and it's because they've had a very, very long flight. They get in late at night, and their domestic flight is not till the next day. For those individuals, the Canada Border Services Agency and Public Health Agency of Canada and IRCC have all agreed they can go to the hotel that is arranged by the port of entry service provider, and then the port of entry service provider will ensure that that 24 hours or 12 hours in the hotel, that they are isolated, that they remain there, that they have access to masks, that they physically distance from anybody else on the way in and out of the hotel. They'll arrange the transportation, they'll make sure they have masks, etc., and we'll do some counseling as well so that they understand what's going on, and we'll make sure they have food. Then they'll bring them back to the airport for their domestic flight the next day, and the refugees, the families, will be allowed to travel to their final destination. When they get to their final destination, that is when the sponsor will take over. That's when you need to be there. You don't need to worry about that port of entry overnight. We take care of that. We've always taken care of that, and we will continue to do so. So I've shown you the requirements. I'm not going to read them. They're fairly straightforward, but what I want to say to you is go and read them. And then you can see underneath that box, it says some provinces and territories have additional restrictions. You need to read those. You need to understand what impacts your region and your office, and you need to make sure you have a plan to comply with them. The other thing you do is in the box underneath, it says you must monitor your health for 14 days. So you have to help educate the family after they arrive in Canada or your refugee in terms of making sure they're monitoring their health, and that if they start to exhibit these symptoms, it's okay. They don't need to be afraid. They have to contact you. They have health insurance. They're going to be able to get health care. And then you can help them in doing whatever needs to be done, including contacting public health. There is also information on what happens if a refugee shows up with symptoms. So this is where it's a little bit different. If they arrive in Toronto, for example, and throughout the course of the flight, a refugee has started to show some symptoms, they get a fever on the flight itself, they're going to be put into mandatory isolation at the port of entry. They won't be able to travel to their final destination. In these particular cases, the government of Canada has arranged for the quarantine facility. So their stay of isolation is arranged by the Public Health Agency of Canada, and they will ensure they're cared for during the 14-day isolation period. Should this happen, the Port of Entry SPO will be letting the department know so that the sponsor can be informed that this is what's happened to the refugee. Okay. Now I'm going to go back to we're going to contact you. So when we are ready, when your family is, or your refugee or individual is ready to move, the department is going to contact you. You're just going to get an email. This is the email. It's going to be in an email, but this is the text of the email. And maybe I'll stop and say, you don't need to speed read. We're going to give all of this to RSTP after this session, and they should be posted next week so that you can go and refer to the information on the website and get a copy of it. But you will receive this email, and there we are asking you to confirm some information prior to us booking travel. So I think there's a couple of things here that I want to flag. And the key one is, what if you are not ready to support your refugee family? What if the support infrastructure, for example, the key person that is going to be providing support to the refugee post-arrival, what if the person who speaks the language, for example, if you've got an interpreter that your group is working with, is a vulnerable person and can't support the settlement and integration of this individual? That's okay. We're not going to shove the family on you. We'll work with you to figure out what is an appropriate time for them to come. But if you need to pause and say, look, I'm not willing, I can't support the refugee now, I can't, please don't book travel for my refugee, you just have to let us know. Now, the obvious question that is, well, but when will my refugee travel, or what happens to that family? And that is a risk, right? We're not going to refuse the application. The application will remain open. Some of the things that may happen, for example, is those clearances that I talked about may expire. So that means the refugee may have to do some of the redo some of the processing steps. It's unfortunate, but that may be a consequence of that. How do you let us know when the refugee is able to travel? You can just send an email back to the Resettlement Operations Center when you're ready. So you're going to get the email from a group, you're going to respond and say, I'm not ready. When you are ready, you just send us an email back. We are grouping the visas and releasing them to IOM. We're not trying to delay anybody's travel. We also want to move these families as much as you want us to move them. So, you know, don't worry that if you say, I can't do it now, that is going to result in us, you know, being angry or saying, that's it, we won't contact you now for 6 months. But if you do say no, like then you're on our schedule after that. So we're going to do our best. It doesn't mean it's going to be a delay, but you know, we'll go back and you know, periodically, what we'll probably do is do a search for those cases that are still pending, and then recontact all the sponsors and say, hey, what about now? It's been a couple of months, are we good to go? But I'm assuming you will just contact us when you're ready within a couple of weeks. It's just that you may need a couple of extra days or weeks to get yourselves organized to receive the refugee, and I can understand that completely. So there is a confirmation process. When you get this email, you have to reply to it. You can't just sort of say, oh, I'll get to it next week. There's we're looking for a 3-day turnaround time. So you have 3 days to respond to the email and say, we're good to go or we're not good to go. And we've asked you to confirm some things here in this email. 2 things that I want to point out to you. You must inform the refugee of your quarantine plan. So when a refugee arrives at the port of entry, they may be questioned by CBS, the Canada Border Services Agency, or by Public Health Agency of Canada on where are you going to quarantine. So of course there'll be a port of entry service provider if they're, for example, entering in Toronto and then they have to fly on to another city. But so that service provider will be able to say to CBSA and to the Public Health Agency, they're a refugee, they have a sponsor, the sponsor's taking care of the quarantine plan. But if Public Health Agency has more questions or concerns around the plan, they're going to ask the refugee questions. IRCC has talked to CBSA and to Public Health Agency, and we've said, please, if you have questions, try not to just rely, or if you have concerns, don't just rely on what the refugee says, contact the sponsor. And so you have to give us contact information so that we know who, CBSA knows who to call if there's a question about the quarantine plan. The refugee should have a copy of that information. And when you respond to this, if you can give us that information as well, we'll put it in our global case management system so that CBSA can look for it if they want. But the best thing you can do is make sure that your refugee knows what's going to happen when they get to Canada, understands the quarantine plan, and has been briefed by you on what's going to happen, and that you give them their contact information. Because if they can self-manage at the port of entry, then everybody will have a lot more confidence of what's going on. It's when people start saying, I don't know, hold on, and I don't know where I'm going, that it's going to cause issues. So brief your family. We've been asked, do you need to provide a written copy of the quarantine plan? That's up to you. If you think your family knows what it is and can articulate that verbally at the port of entry, there will be an interpreter there to help with the conversation. But if you think your refugee family is fully able to explain and say, yep, a house has been arranged for me. I'm being picked up by my sponsor. They're going to take me directly to my house. They're going to arrange for delivery of groceries, and I know I have to stay there for 14 days. I think if most refugees can clearly communicate that, you're good to go. They may get asked for more details, and if they can't answer the details, then at that point they can say, here's the contact information for my sponsor. Please contact my sponsor, and they'll give more details. And then you need to be ready to answer those questions when CBSA calls. So I will stop there on the sponsorship capacity, I think. And I'm going to go back to our table, and we'll talk about the last step. So IOM now is booking a flight. What's going to happen at the point of departure once travel has been arranged? First of all, we have made arrangements with the International Organization for Migration to provide the Canadian orientation abroad through phone. Not everyone is going to be able to get this orientation session, although we're trying to reach as many as we can, or IOM is trying to reach as many as they can. They will also be provided counseling at the departure point with regards to wearing a mask and ensuring proper hygiene on the flight and how the process is going to work. So just the overall travel experience in this, unsettling time. This is kind of a weird time to be traveling. In some cases, IOM will also do a pre-departure health check. So they're going to try and do health checks for almost everybody as long as there's capacity on the ground to do so. But in some cases, the airlines or the country where the refugee is departing also have additional health requirements or public health requirements to do things like temperature checks, or in some cases, they need to have a COVID test done within 2 weeks before they depart saying they don't have COVID-19. So IOM will take care of all of that for whatever the pre-departure requirements are. The question that we've been getting is, does every refugee get a COVID-19 check before they leave? And the answer is no. And I'm sure you're all wondering why not? And that's because it's not a requirement to enter Canada. Canada is managing risk by making everybody do a quarantine after they arrive. So you're not relying on a test that's taken 1 to 2 weeks before they depart, where they don't know the quality of the healthcare system or who's doing the test. They're just essentially managing at port of entry and ensuring that everyone isolates or abides by quarantine requirements as soon as they arrive in Canada. That's the process. I'm not a health expert. I'm not judging PHAC's approach or why the government is choosing to do this way, but that's the requirement. So that's the process that we're following. I want to say lastly that we also got some questions on our government assisted refugee side, and I'll share them with you because I'm sure some of you maybe have this question as well. Why are we asking you to help the refugee quarantine at the final destination versus putting them in a quarantine facility at their initial port of entry, their international port of entry? And again, there's a number of reasons for that. Canada has assessed the risk and they have identified what the requirements are. So anybody is going to be allowed to travel to their final destination if needed on their domestic travel. And then once they get to their end destination, that is where they would engage in their quarantine. Having a family quarantine in a hotel room, for example, for 2 weeks by themselves is not an ideal situation. I think everybody wants to get to where they're going. This is going to be a lot of upheaval at this time. So whatever we can do to get refugees into their final destination, into their final communities, let them do their 14-day quarantine, monitor their health, and then they can start to resume their settlement process in final destination. We just don't want to add another layer of upheaval. So that's the process that's going to be implemented, and I'm happy to answer more questions about that if you have any. So I know I've thrown a lot of information at you. Hopefully I've covered everything. I'm sure I've left out some key pieces, but I'm sure we'll cover that in the Q&A. And with that, I'm going to turn it back to Sunit, I believe, who's going to moderate the question and answer part of the day.